Hello, my name is Maria Perina Zambrano Castro. I am a student of medicine and I am going to expose you about Apixaban to prevent venous thromboembolisms in patients with cancer. Definition: venous thromboembolisms (VTA) is an important cause of morbidity and mortality in cancer patients. While anticoagulation for VTA associated with cancer is limited to vitamin K, ABK, and heparin antagonists for several decades, as a new therapeutic option, and direct oral anticoagulants have recently emerged.
Venous thromboembolism is a common complication of cancer. While subcutaneous low molecular weight heparin is the standard treatment for cancer-associated venous thromboembolism, the role of direct oral anticoagulants is unclear. A randomized open-label non-inferiority study of 1,046 patients with cancer and confirmed venous thromboembolism tested the efficacy of anticoagulant therapy for up to 12 months. One group was treated with subcutaneous low molecular weight heparin for at least 5 days, followed by 60 milligrams of oral Apixaban once daily. The other group received 200 IU of subcutaneous dalteparin per kilogram once daily for 1 month, followed by 150 IU per kilogram thereafter. The primary outcome, a composite of recurrent venous thromboembolism or major bleeding event during the 12-month follow-up, occurred in 12.8% of the patients receiving Apixaban, as compared with 13.5% of the patients receiving dalteparin. Statistically, this result demonstrated the non-inferiority of Apixaban to dalteparin, but did not demonstrate its superiority. Recurrent venous thromboembolism occurred in 7.9% of the patients receiving Apixaban, as compared with 11.3% of those receiving dalteparin, and major bleeding occurred in 6.9% of the patients receiving Apixaban, as compared with 4.0% of those receiving dalteparin. The authors conclude that in patients with cancer and venous thromboembolism, oral Apixaban was non-inferior to subcutaneous dalteparin for preventing the composite outcome of recurrent venous thromboembolism or major bleeding. Apixaban's lower rate of recurrent thromboembolism was offset by an increased risk of major bleeding. Full trial results are available at nejm.org.
The New England Journal of Medicine. Application in medicine. Patients with active cancer have an increased risk of venous thromboembolisms, and which results in substantial morbidity, and mortality and healthcare expenditures. And the Corona score range of 2-6 with higher score indication in higher risk of venous thromboembolisms has been validated into identify patients with cancer at elevated risk for this complication and may help select those who could benefit from thrombo for prophylaxis.
Medicines like dabigatran, rivaroxaban, apixaban, etc., they belong to a class of drugs called anticoagulants. What these medicines do is they basically thin your blood, especially if you have a condition that predisposes you to form blood clots, like an irregular heart rhythm, or you've had blood clots in your legs or your lungs or any other part of your body. These medicines basically thin the blood in the body, and because your blood gets thin, you have a higher tendency to bleed. So you may bruise easily, or you may injure yourself, and you may bleed a little bit more than normal. So it's important when you take these medicines, try and avoid any contact sport, or try and avoid anything where you injure yourself and you will bleed more.
Pros and cons. Does not need monitoring of patients' international normalized radio, predictable pharmacokinetics and pharmacodynamics, and the risk of major bleeding is 3% or less and clinically relevant non-major bleeding is 2% to 4%.
By now, the safety and efficacy of the NOACs is pretty well established, but little is known about the impact of appropriate dosing on the effectiveness and safety of Apixaban and rivaroxaban, which is what we're talking about specifically in patients in real-world practice. So we're here to discuss the REVISIT US study and its real-world evidence of stroke prevention in patients with non-valvular atrial fibrillation in the United States. And to do so, I'm with Dr. Paul Burton, who is an MD and a PhD and a Vice President of Medical Affairs at Janssen. Now, this is data that's being presented at the European Cardiac Arrhythmia Society in Paris. Tell me a little bit about the trial, first off.
Yeah, so the REVISIT US study is a very interesting study for us. It's just under 31,000 patients, so it's large. It's a real-world claims database analysis, and it compares rivaroxaban to warfarin and Apixaban to warfarin. And it asks a question, what are the rates of important clinical events, irreversible harm, so intracranial hemorrhage and ischemic stroke? These are the events that we know physicians and patients fear most. What are the rates of those in real-world practice? So the results are fascinating. What we find is that the rates of intracranial hemorrhage are reduced by 47% significantly for rivaroxaban versus warfarin. And we find that the rates of ischemic stroke for rivaroxaban versus warfarin are reduced by 29%. That is just not significant.
These are data coming from, a couple of trials that you're using data from Aristotle and the registration trial for Apixaban and Rocket AF, which was the registration trial for rivaroxaban, correct?
So Rocket AF was the registration trial for rivaroxaban. Aristotle was the registration trial for Apixaban. Right. So these numbers, though, are what we're now finding in the real world. Right. So they're very encouraging and really demonstrate the continued utility of rivaroxaban Xarelto in the real world in AFib patients.
Now, in terms of dosing, because that's kind of the interesting area where we haven't had a whole lot of data before, what did you find there?
Well, the interesting thing is, so we find a reduction in intracranial hemorrhage and ischemic stroke for rivaroxaban versus warfarin. With Apixaban, there's also a reduction in the rate of intracranial hemorrhage, a small 13% non-significant increase in the rate of ischemic stroke. We know that there are differences in adherence with twice daily and once daily drugs. We know that patients also, or physicians, prescribe different doses of drugs. So it's an interesting finding because it tries to integrate real-world use of these agents with clinical outcome. And again, we find very robust, consistent reduction in these important events with Xarelto.
So is there a lesson to be learned? I mean, doctors are really concerned about the risk of bleeding. And of course, patients need to be concerned about not only that, but also the potential down the line of a stroke. So in terms of dosing, what can you say about a lesson learned from this?
Yeah. I think we published a study a while ago that showed that patients and physicians fear stroke almost as much as they fear dying. We believe that you must not trade off a reduction in bleeding, which is preventable and is treatable, with reduction in an event that is irreversible, so a stroke. I think what we see here in this study for the first time is, again, consistent reduction in these endpoints for Xarelto. Taking drugs appropriately. There's a very famous quote by C. Everett Koop that drugs don't work in patients who don't take them. Right. And it's true. Xarelto is a robust, once-daily medicine, and it continues to demonstrate its great clinical utility here now in the real world, just as it did in the randomized studies.
Were you able to look at how well doctors are following the guidelines in terms of dosing?
We haven't looked at that here. Our work certainly is not done. We continue to do that. We have 91,000 patients now in real-world studies. And you know as well as I do that this Explorer program of ours, when all said and done, will have 275,000 patients enrolled in new indication-seeking trials as well as real-world evidence. And I think that when all said and done, we'll be able to really definitively answer that question. But these data are provocative, and
Application in Ecuador, the entrance to the pharmaceutical market of new agent oral anticoagulant that do not require adjustments and dose monitoring by periodic blood tests and open an excellent opportunity for the launch of Apixaban.
This information is provided for public education purposes only and is not intended to substitute for a manufacturer's directions or consultation with a licensed pharmacist or healthcare professional. All medication, including those available over the counter, can be harmful if not used as directed, and taking more than one medication could result in harmful drug interactions. Please consult a licensed pharmacist or healthcare professional before taking any medication or changing an already approved or prescribed medication plan.
Hi, my name is Levi, and I'm a student pharmacist here at the University of Arkansas for Medical Sciences. Today, I'm going to talk to you about your medication, Apixaban. Apixaban is also known by its brand name Eliquis. Apixaban is a medication used to treat blood clots and to thin the blood to prevent clots from forming in the bloodstream. Apixaban is usually taken by mouth, with or without food, and most commonly twice a day. If you miss a dose, take the missed dose as soon as you think about it. If it is close to the time for your next dose, skip that dose and resume your normal dosing schedule. Do not take 2 doses at the same time or extra doses. Some common side effects with Apixaban include hemorrhage, nausea, and bruising, and some less common side effects include skin rash and tiredness. While taking Apixaban, remember it is important to tell your doctor or pharmacist if you have signs of an allergic reaction, a spinal or epidural procedure, because some time may need to pass between the use of this drug and your procedure. If you have any signs of nerve problems like back pain, numbness or tingling, muscle weakness, paralysis, or loss of bladder or bowel control. If you have any signs of bleeding problems like bruising, black, tarry, or bloody stools, bleeding gums, blood in the urine, coughing up blood, cuts that take a long time to stop,
And is not intended to substitute for a manufacturer's directions or consultation with a licensed pharmacist or healthcare professional. All medication, including those available over the counter, can be harmful if not used as directed, and taking more than one medication could result in harmful drug interactions. Please consult a licensed pharmacist or healthcare professional before taking any medication or changing an already approved or prescribed medication plan.
In conclusion, Apixaban therapy results in a significantly lower rate of venous thromboembolism than the placebo monitored medium to high-risk ambulatory patients with cancer who were starting chemotherapy. The rate of major episodes was higher with Apixaban than with placebo. Thank you.